Our guest today will discuss the practical realities, dealing with symptoms, treatment, and lifestyle adjustments, but also the emotional impacts, the feelings involved, the effects on relationships and daily living.
I'm Simon. I'm 50 years old. I'm from Barnsley. What I have to deal with day to day mainly is my type 1 diabetes. So there's a real lack of support, and it just feels you've been left out on your own. I can't work anymore, and that it's a real pressure. You feel like you're not contributing anymore. It feels like you've lost your dreams or all the things that you maybe wanted to do in your life.
I'm Sarah, I'm 24 and I'm living in Oxford. And I live with severe asthma and chronic urticaria. I had an old male doctor who was quite dismissive of me as a young female patient. And I had to take my dad along to the appointment to kind of advocate on my behalf.
My name's Aaron. I'm 29 years old and I had severe respiratory problems from birth. The impact it's had on my mental health has been terrible. But the reality is of when you're not getting better and you've got a long-term health condition is that you just got to kind of manage it by yourself.
I'm Gillian. I live in Birmingham and I have a number of disabilities: diabetes, high blood pressure, physical disability, autism, asthma, hay fever. People do want to work. People with long-term conditions, we just need support. And I think this area needs to be looked at because it affects a lot of people.
I think waiting times to get specialist therapies and treatments should be reduced. And also a sense of believing patients. My previous team didn't believe me all the time. They would question my when I expressed the impact it was having on my day-to-day life, they would question that, despite the objective test results, which proved that I had inflammation in my lungs.
I think one of the main things that would be a massive game changer for me is knowing who is taking the lead in my care and knowing who my first port of call is.
Two things I feel that would just hit it on the nail for me is someone that cares, and with care I mean good manners, and you can call it a care coordinator.
It would have to be proper mental health support for me.
For considering a whole person approach rather than kind of breaking it up.
It always seems to be dealing with waiting until somebody is in absolute crisis point to take action. Feels like I've had to kind of wait to get to absolute rock bottom for people to kind of notice.